Hey everyone, welcome back to TYP, Terminally Yet Purposeful. It's Megan again, and we're starting the What to Expect series. And this video is for Mary. Thank you for this idea. This was a good idea. And I hope your sister-in-law is doing really well, okay? So the first video of what to expect is what to expect when you're starting chemotherapy. So I've been getting chemotherapy, traditional infusion chemotherapy, for over a year and a half now. And I am most likely going to start the transition to an oral chemotherapy soon. So we'll talk about both of those. And just because it's a little bit shorter, we'll talk about oral chemotherapy first. So when we think of chemo, chemo comes in a couple different forms, right? And the most traditional ones are an infusion chemotherapy, which is intravenously delivered into your veins, or orally, which is taking a pill, usually twice a day, sometimes up to 4 times a day. Everybody's different. Everybody's chemotherapy is a different regimen. So this is not a one-size-fits-all. So the most important thing is to follow your doctor's advice, right? First and foremost. But when it comes to my experience with chemotherapy, oral chemotherapy, it's not easier than infusion chemotherapy. It might be easier in the sense that you're not going to the hospital every week or every 2 weeks and getting hooked up to an IV and stuff like that. But you're still getting chemicals delivered into your body, which is rough, it can be. And it's just a little bit different. It's, maybe a slightly lower dose, but on a more regular basis. So all of the side effects that you get from infusion therapy, you can also get from oral chemotherapy as well. So just because you get oral chemotherapy doesn't mean you're not going to lose your hair or have the fatigue or nausea that you would get in infusion therapy. Everybody's different. But it's not necessarily easier or harder, right? So oral chemotherapy, the important thing is chemo is chemo. It's still chemicals that you're taking on a daily basis. So it is a little bit dangerous. It's good for killing cancer, but whenever you're taking oral chemotherapy, you have to be careful. The oral chemotherapy that I'm going to start taking, they say that I can't even touch it with my hands or my skin. I have to wear gloves if I'm going to touch this pill, which is, pretty wild. So we have to be careful that, we don't get it in our eyes or on our face or near, on our skin, unprotected skin somewhere, that we just take it very much as prescribed. Don't keep it out in direct sunlight or near pets or children or anything like that. And the important thing is that you take it at the same time every day when you're supposed to take it. So if your doctor says take your oral chemotherapy at 7 a.m. and 7 p.m. every day, then set your alarm, the timer on your watch, and when that goes off, take your chemotherapy immediately. That's very, very important. And that's oral chemotherapy. It's still serious. It's just more routine and less of a hassle. It depends on how you look at it, than infusion chemotherapy, right? So traditional infusion chemotherapy is what a lot of people get. It's what I've been getting. And it's delivered intravenously, like I said, and that can happen in a few ways. Some people get chemotherapy kind of, right into a vein. So they'll start an IV maybe in your arm or your hand or your wrist, wherever they can, essentially. And then they'll hook you up to an IV or a pump. And that's how you get your chemotherapy. I have a port, and most people that have long-term chemotherapy also have ports. Usually they're in your chest. Sometimes they're also in your arm. And a port is kind of an access point. It's something that they kind of install. It's like a little implant almost that they put right under your skin. So it's internal, but just barely. And it goes right into a main artery. And it's a very fast and easy way to deliver chemotherapy where you need it. So actually you can kind of see it a little bit in the video, this little scar here. And there's a little dimple underneath it. This is my port. So I can feel it. It's always there. And when I first got it, it really freaked me out that I could feel it. And you do have to be careful with it. Like, don't get hit with a soccer ball or anything like that really hard right in the port, because that can be really dangerous for us. But once you get used to it, it's not so bad. And if your doctor recommends that you get one, don't be afraid of it. It doesn't hurt. And it makes getting chemo very easy. And it saves your veins in the long run. It really does. It just makes things a little bit more streamlined in general. So if you have a port, a qualified nurse is the only, not every nurse can access a port. Only qualified trained RNs and BSNs can do it. They have to be trained to do port access. So make sure that's happening, okay? If anyone ever asks to access your port. So if you have a port, what they'll do is take kind of a 2-inch long needle and they'll stick it from the outside into this access point under your skin. That might look scary, but it actually doesn't hurt. It really doesn't. I think it hurt the first couple times, especially when this was freshly put in and tender. But I hardly feel it anymore. And if you have a good nurse, it's even better, you know. So they'll stick this long needle into your port. It'll kind of click a little bit. And then they'll start flushing saline through your port. And they'll pull back, and they want to find blood, actually. When they pull back, there's going to be a syringe and a tube that goes in there attached to that needle. And they'll pull back on the syringe, and they'll be like, oh, there it is, you know? They'll actually find blood in the syringe, and that's a good thing. A lot of times you see blood, and you're like, oh, God, what's going on? That's actually a good thing. That means that your port is working properly, that blood and fluids are exchanged freely back and forth throughout there. And there's no clogs, there's no kinks, there's no clots anywhere that's preventing the chemo from actually getting to where it's supposed to be. Okay? So don't be freaked out by that if it happens. It's a good thing. So after that, they're going to access your port or do an IV. And before you even get your chemo, they're most likely, for most chemotherapy regimens, they're going to take your blood. And they're going to check that your white blood cells are high enough, your platelets are high enough, and that your blood is generally in good shape and your body's in good shape to receive chemotherapy. Because chemo does a number on us, and you want to start at a good place so that your body can recover when the chemo comes in and sort of wreaks a little bit of havoc on our bodies. It wreaks havoc on the cancer, but it can also do a little bit of a number on our blood and our other organs. So we just have to be careful, right? So once you get your blood drawn, either through your port or your IV, you're going to wait around a little bit for the blood to come back, your blood results to come back. And that could be a half hour, that could be an hour. It all depends. And once you get your blood work back and somebody comes out and they're like, okay, you're good to go, let's take you back into the infusion room, right? So you'll probably go into the doctor's office at the hospital, you'll check in, you'll get your blood drawn, you'll wait, and then you'll go into the infusion room. And all infusion rooms are different looking. In my experience, they're generally larger rooms. You don't have kind of a private chair or a room to get your chemo. You're kind of all out there together. You might have a curtain separating you from other people. You might not. But you'll go back there. They'll take your vital signs. They'll take your blood pressure, your weight, ask you some questions, ask you how you're feeling overall, just to make sure you're okay. And you'll sit in the chair and they'll ask usually if you need anything, if you want water or food or crackers or blankets. And I highly recommend saying yes to all of that, right? So you might not be cold, but you might be in the infusion room for a while. And I always get cold when I get chemo. So even if I'm not, when I walk in there, I say yes to a blanket because I might fall asleep and want that. Or I might get cold and want that. Or it just might be nice to have something soft in front of you and comforting, right? So say yes to a chemo and a pillow if you want. And you have to stay hydrated during chemo. So if they ask you if you want anything to drink, I would recommend that. It's also good to have a little bit of something in your stomach if nausea is an issue. And nausea is an issue with most chemotherapies. So I would recommend that as well. So once you sit down and you get comfortable, if you have a port and you got blood taken out of it, you're already going to have an access. So once they stick that needle into your port to get your blood work, they're not going to take it out again. They're going to close it up with some saline, make sure no blood's coming out of there anymore. And then they'll kind of tape it down so it doesn't snag on anything. So when you sit down to get chemo, they'll kind of unhook that, untape it, and they'll hook it up to an IV pole or a pump or something like that. And usually they'll start saline. And same thing if you got blood work done out of your arm, we'll start an IV into your arm and attach it, same thing, to a pump or a pole. And usually give you some saline or something like that. Now, a lot of people, when you start chemotherapy, they'll say, okay, this isn't your chemo. When they hook you up, they'll be like, we're giving you your pre-meds now. And usually what pre-meds are, they can be steroids to counteract the effect of the chemotherapy, or because you can have both, they can also be anti-nausea medication or antiemetics, they call it. Because for most people, chemo makes you nauseous. So you may get stuff like Zofran put in there. Sometimes they'll give you Benadryl if you have kind of a reactive chemo or you have a history of being allergic to something in the chemo. They might get you, Benadryl right in a bag of saline, which is helpful for when they ask you for that blanket, because a lot of people get Benadryl like me, and they are knocked out then for the next few hours. So that's usually what pre-meds are. So you'll be in the infusion room, freshly hooked up, and you'll probably get some saline, maybe some pre-meds, and then the nurse will be like, okay, they're mixing your chemotherapy now. So normally you're not going to walk in, sit down, and get hooked up to your first bag of chemo right there. Chemo is kind of a reactive drug, and they like to mix it up right before they give it to you. So most likely, they're not going to go into a warehouse and get an old bag of chemo off the shelf and stick it up there and give it to you. It's going to be fresh. It's going to be made for you in your dosage. And sometimes that takes a little while. So they might hook you up and give you your pre-meds or some saline. They might say, oh, the pharmacy is running behind. Just hold tight for a little bit. That happens. But once you get your chemo, your nurse will come in with your bag of chemo, and she'll start setting you up to get your chemo. And usually they need a second person just to verify that everything is correct. This is kind of like dual factor authorization, if you will. They'll bring another nurse over. They'll be like, hey, can you verify this for me? And they'll just check the bag, make sure it's the right chemo, check your chart on the computer or in paper. And you'll hear them repeating some things back and forth. This is like patient number, whatever, Megan Thrash getting 1,600 milligrams of gemcitabine. We're good to go, that kind of a deal. Once that's done, they'll hook you up. They'll be like, okay, your chemo started. And then ask them how long it should take for you to get your chemo. Because this could be as little as 30 minutes. Or like me, when I first started getting chemo, I was getting cisplatin. It took 7 hours. And it took 7 hours because some more heavy-duty chemotherapies like cisplatin, was getting several bags of them, right? And it would be like, okay, here's your bag of cisplatin. Then we're going to give you a full bag of saline, and then cisplatin, then a full bag of saline, cisplatin, maybe a couple bags of saline. And they just want to get your body hydrated and, okay to receive the chemotherapy. And oftentimes they want to keep you hydrated so that the chemo is not sitting in stuff like your bladder or your organs for longer than it has to, because it could do some damage. But if you're doing a long chemo, prep for that, right? Bring a book, bring headphones, bring your phone, bring something to do, and be comfortable, be in comfy clothes. Take your contacts out maybe and wear your glasses, because you might fall asleep too. Especially 7 hours, that's a long time. It's a good time to take a nap. Especially because chemo, some people ask me, what does chemo feel like when you get it? And honestly, it doesn't feel like much. It shouldn't hurt. If they hook you up to your chemo, and especially after that initial prick, once the needles in there and stuff like that, and things are starting to it's starting to flow, it shouldn't hurt and it shouldn't bother you. And if it does, you should tell your nurse, because they probably need to adjust something, or maybe the pressure on your pump's too high. So say something if that's the case. But otherwise, chemo is not a painful process not for me, right? And I didn't feel much when I was getting chemo. Some people may be different, and some chemos might be different. But ask your doctor. But if it does hurt, say something to your nurse, because it probably shouldn't. But take that time. If it's a half hour, if it's 7 hours, most likely it's going to be something in between. Take that time to relax and try and get some rest, kind of de-stress, and let the chemo do its thing, right? Because you don't need to be stressed out on top of having cancer. It's not great. So just use that wisely, right? Get your blanket, your food, your water, your drinks, your ginger ale, your crackers, what have you, and try and relax while you're getting your chemo. And once everything's done, once you get your chemo, if you are hooked up to an IV, usually it's on a pole that you can bring with you so that you can go to the bathroom, especially if you're there for a while. You're getting a lot of fluids put into your body. You're going to have to use the bathroom. And it's probably encouraged, actually, so that things don't sit into your bladder. So don't be afraid of that. Don't be afraid if you have to go to the bathroom, because they can hook you up with a movable pole or take your pump out of your wall, and you should be able to do that no problem, right? And once it's done, we'll come over and they'll flush out your port or your IV tube, whatever you have there, which is essentially they'll take a syringe of saline and just clear everything out and make sure everything's clean. Your veins are going to be in good working order. And if you have a port like I do, they might ask you if you're allergic to blood thinners or heparin, and they'll give you a syringe full of heparin in there as well, either before or after the saline. And that's just to make sure that you don't get a clot that develops either in your port or around your port, so that it keeps your port working well for you well into the future, right? Don't be afraid of that either. And once you're all flushed out, they'll take the needle out. It shouldn't hurt. Or it should, and they'll probably say, okay, I'm taking the needle out, take a deep breath. And they'll take that right out. And it kind of just unclicks. You don't feel it very much. And then you'll either get a Band-Aid or a piece of gauze here. And I would recommend, if you can, getting a ride to chemo, especially the first few times, because you don't know how your body's going to react. Especially the first time you get chemo, your nurse might make you sit in the chair even after you're done for probably up to a half an hour, and they'll just check to make sure you're not having any reactions. They'll check to make sure you're not having a rash. They'll check your face, your chest. They'll check your like your hands and your feet to see if you're retaining any water. They might take your blood pressure again and your temperature, just to make sure that everything's okay, right? But, after that, they'll probably be like, okay, you're good to go, send you on your way. And you might get some instructions to take home, like make sure you drink a lot of water. Your nurse might say that to you. Or make sure to take your Band-Aid off when you get home or the next day or something like that, and give that a chance to heal. First and foremost, listen to your doctors and your nurses because they know what's best for you, right? So whatever they tell you to do, do it. And that's infusion chemotherapy in a nutshell. And it's a process, and it's scary at first, but it'll be something that you probably get to get used to rather quickly, right? Because that's life. And I was really terrified of it at first, but now it's part of my everyday life. It's just gotta go get chemo this week, kind of a thing. But try and relax. It can be a scary experience at first, but kind of use it as an opportunity to rest and recharge. And yeah, that's it. If you have any other questions, please leave them on any of our platforms or send me an email, terminalyetpurposeful@gmail.com. And we will go over in the next video a little bit about side effects from chemo, oral and infusion, and what to expect when you're done your chemo in the days after that, right? So thanks for hanging with us tonight. I hope this was helpful. And thank you, Mary, again for that suggestion. And again, thoughts and prayers for your sister. I hope she's doing really well. And if you guys need any extra support, please reach out to me, okay? So have a good night. Do something good for yourself, okay? Bye, everybody.